Iriam Gonzalez is a doctor from Venezuela, just finishing a 24-hour shift in a Mexico City hospital. She has been in Mexico nearly 3 years after fleeing the economic and political crisis in her home country. Yet after arriving here as a refugee, she didn't find a job waiting for her.
When we first arrived, my daughter was 1.5 years old, and you have to start earning money, whether it's a lot or a little. You have to start working in whatever you can find. So I first started working in a restaurant. My parents taught me whatever you do it well. No matter what it is, give the best of yourself.
But after COVID-19 arrived here, the shortage of essential medical workers opened up positions in public hospitals across the country for dozens of medical professionals fleeing their home countries. To be back working in her professional field has brought a great source of satisfaction and an opportunity she hopes can help her in her career ahead.
We've been given contracts for the length of the pandemic, but through the work that you are doing, it can open opportunities later in the same hospital or any other one. You build up a good reputation.
Silvia Garduño heads up the UN Human Rights Commission in Mexico and was instrumental in finding work for these marginalized medical professionals.
Refugees don't come with empty hands to the country that received them, so now I expect the country to give me everything. No, that refugees can actually contribute to the countries that receive them. But for them to contribute, we have to give them the chance to do it. And yes, this particular situation could help us to change this perception or negative perception that people might have about refugees.
Silvia says these frontline workers may eventually improve the overall perception of refugees across the country. As Mexico turns to its often marginalised refugee population for medical assistance, the hope is that their contribution during the country's time of need will make them a more valued part of society in the long term. Alistair Baverstock, CGTN, Mexico City.